Hello, fellow people with type 1 diabetes. Today, I'm going to talk about pros and cons of pumps and shots. Which one are you on? Which and why? Do you want to switch? Are you sick of your pump? Are you wanting to try a pump? Where are you at? That's what we're going to talk about today. If you're just finding me, my name is Dr. Jody Stanislaw. I've had type 1 for 40 years. And let's see how I'm doing today. I am doing pretty good. There's my numbers for today. Pretty good. And I actually am on shots. I'm on shots. I actually worked for a pump company before I went to med school, so I've done the whole pump thing. And, well, to give you a little background, I work with type 1s all over the world. I've had a virtual practice for almost 10 years. I have online courses. I get really frustrated with how I feel like those of us with type 1 don't get the training that we need to really be able to achieve a really healthy A1C, which is a 6.5 or below for most people. And I thus have dedicated my career to putting out free videos like this and I sell videos and I have that I do with patients because I'm trying to make a difference in really giving you the education that you need to thrive with type 1, right? To know how to exercise and not go low. That was life-changing when I learned that. How we can go to sleep without worrying about being low and have a nice flat line. You know, how to dose for complex meals because carb counting doesn't always work. These are my passions that I love to teach. And the more you follow me, the more you can learn all those things. But today, I just wanted to address this whole like pump versus shot thing. First of all, pumps have been kind of put in this glorified position of like, that's the way you're supposed to do your diabetes. And for those of you that are fine doing shots, I just want to let you know that I have a A1C in the 5s and low 6s and I'm on shots. So that's totally possible. The reason why I think people think that shots are, you're not going to be able to get great care is the problem is many people aren't thoroughly educated on how insulin works and how to dose it properly. And that is what my How to Get Off the Blood Sugar Roller Coaster course teaches and what I teach my private patients and, what I've achieved myself. So it seems like there's so many people that think a pump just figures everything out for you. And up until last year, that didn't exist. Now, of course, it's very exciting. Medtronic has their closed loop. It's the first generation, so I think there's a lot of issues with it. I know some people that love it. I know a lot of people that don't. And then, of course, Tandem, the Control IQ is coming out. Omnipod is hoping to get one. Closed loop, now that's the dream, right? That the pump talks to the continuous glucose monitor and it actually can help us reduce lows and highs. These closed loops are never going to be able to dose for us, right? But because they don't know what we're eating. But, a closed loop pump that is effective at reducing highs and lows is awesome. But that still isn't what the majority is on, right? If you have a pump, you still have to think. You still have to use critical thinking. The best thing about a pump that I actually miss being on shots is being able to fine tune my basal rate, right? We always need a little bit, maybe more insulin in the morning to cover dawn phenomenon, maybe a little bit less. Temporary basal rates, if you're going to go exercise for a long time, if you're going to be sedentary for a long time, it's really easy to change your basal rate on a pump. I love having the memory of like, yes, you just bolused 1 hour ago. Because when I'm on shots, sometimes I think, oh gosh, have I done my shot yet? So the memory factor and the finite adjustment factor I miss on pumps. But why I don't wear a pump is, we have so many things that we have to kind of deal with. As it just felt like another thing to deal with, more supplies, more stuff to buy, this thing on your body. And I didn't like the constant reminder of having it on me all the time. I mean, because I think about it all the time anyways. So I didn't need a physical reminder of it. So that's how I feel. If you love your pump, I say awesome. If you're sick of your pump, I want to inspire you that you can get great blood sugar levels on shots. If you're on shots and doing great, I say don't feel like you're in the dark ages, even if people make you feel that way. But if you're on shots and want to try a pump, great. So those are my options. There's definitely pros and cons to both. And there is a video that I did with Gary Shiner that's in my How to Get Off the Roller Coaster course where he and I had a very funny, lighthearted debate. And he's big a pro pumper and I'm a pro shotter. So that's in my how to get off the roller coaster course. But I've been coming live since the lockdown. This is probably about my 60th Facebook Live now. I do them right around 3 o'clock Pacific, 6 o'clock Eastern, Monday through Friday. And I'm here to inspire us with type 1s to live a healthy and happy life. If you're struggling at all, I promise you my resources will help you. Take a look at my website, drjodynd.com, and click on T1D classes. And I've got brilliant, simple, easy classes for you. Nutrition and dosing, exercise, roller coaster. You deserve to know how to make all the adjustments you need to get an A1C below 6.5. That is my mission. That is what I'm here to help you do. So I hope you've enjoyed today's video. Please leave a comment. I always love to get your guys' feedback on what you like and what you're learning. What are you struggling? What are you struggling with? I'll address that in tomorrow's video. Have a great day, everybody. Check out my website, drjodynd.com, for great free resources as well. And I'll see you tomorrow. Bye.